Yeah, so I've talked about the introduction to the course already. It's not a difficult subject anyway, and as we are nurses, some of us have worked for many years, so I know that it won't be difficult for us, right? And it's an interesting course anyway. It has a mixed feelings. A time will come you have to cry. So those in Nigeria, you are going to cry in your language when the patient dies. In case you are caring for the patient and the patient dies, you are going to cry in your language. And then those in Ghana too, we have various tribes. You are also going to cry and demonstrate for us how you mourn the death, right, in your various tribes. So all these things are there, right? So it's a kind of a mixed feeling things, right? Because you are going to care for a patient who is dying, and then sometimes some of them survive, some may also die. So we are going to look at all the various aspects, those who survive, what you do for them if you die, what follows the death, and all that. So you'll be looking at grieving, mourning, and all that. Okay. So starting the course, as nurses, we know that when we go on duty, many patients come and then some diagnoses are given them, right? So some people are diagnosed of malaria, some people are diagnosed of typhoid fever, some people are diagnosed of peptic ulcer and all other conditions. I should go to the WhatsApp. So how do I do that?
Once we can speak.
Okay, so the class is being recorded after the class. So you can revisit the page and listen to it again, right? And then I think in case you are not online, when you join later, you can have access to it and then listen to it. Okay, so I was saying that there are several conditions that people are diagnosed of, right? So we have hypertension, we have CBA, etc. Right? Some of these conditions have a cure, right? And there are other conditions that cannot be cured, right? So conditions like HIV, conditions like cancer, right? Can anyone remember any other condition apart from HIV and cancer? Any other condition that cannot be cured or that is considered as a terminally ill condition? Can anyone help us with that? Apart from HIV and then cancers, is there any other condition that cannot be cured?
Ebola.
Ebola. Okay.
Diabetes.
Diabetes mellitus. Okay.
Nerve sclerotic disease.
Okay, so someone said end stage renal failure, and then the other thing that you said.
Nerve sclerotic disease. Nerve system sclerotic disease.
Okay. Any other? Okay, so
people that have spinal cord injury,
spinal cord
injury, severe or total spinal cord injury.
Okay, that is fine. So it means that there are some conditions that can be cured, right? And then there are some conditions that is termed as terminally ill, right? So once you have it, it means that we have to manage you. The signs we can't cure it, so we only manage the signs and symptoms of that condition, and that is the course that we are doing this semester. So palliative care, that is what we are doing. Palliative care is an approach to care. So you can use your slides and then you move along with me. Palliative care is an approach to care that through the prevention and relief of suffering seek to improve the quality of life of patients and their families, right? So if we talk about palliative care, we are not only focusing on the patient, but we are also focusing on the family. That is what most nurses are not good at, right? always we concentrate on the patient. Sometimes when family members are even coming around, we want to drive them away and all that, right? But if we talk about palliative care, it focuses both on the family and then the patient, right? And it doesn't aim at curing the condition, right? The aim is to help to relieve the suffering, right? So the signs and symptoms that the patient is going through, the pains, the dyspnea, etc., right? So our aim is to help to relieve those signs and symptoms, right? The suffering that the patient is going through, so that the patient will die peacefully, right? So the patient has to die smiling, and then we can make it happen, right? Especially those who are working at the geriatric ward, and then those working on people who are chronically ill, probably the those with gynecological cancers and other types of cancer, right? So we have to make sure they die smiling, right? And then how can we do that? Right? There was a patient we admitted during the Christmas season. The patient, the wife reported that the patient took in alcohol the whole night, and then the patient did not eat anything. So I assumed the patient went into hypo, right? So they brought the patient in there, and then the patient was smiling. So when I saw the patient, I thought the patient was even alive. So I got close to the patient. So the patient was smiling in the process before he died. So you can see the smiles on the face. So if you don't get closer to do proper assessment, you will not know that the patient is alive, right? So it's our duty as palliative, or it's the duty of a palliative care nurse to make sure the patient dies peacefully, or the patient dies smiling, as I said. WHO in 2013 defined palliative care as active holistic care of patients whose disease is not responsive to curative treatment, right? So what it means is that the palliative care emphasizes on diseases that cannot respond to cure, right? So there are diseases that we only treat the signs and symptoms, right? So, and then it's a holistic care. What do we mean by palliative care being a holistic care? What does the holistic care means? Can any one of us help us?
Because it cater for spiritual need.
It's not clear. It's not clear.
Please,
It
palliative
cater
care is
for
an all
spiritual needs of the patient.
Okay. I think I'm getting it now. Yeah. So, Kayode Olabisi said that it focuses on the spiritual needs, right? Okay. What are the other needs? The other
palliative.
needs. So the spiritual aspect.
Palliative care is an all-encompassing care which brings together
Yeah,
ultimately
social
the
needs,
social, the
family
physical,
needs as
the
well.
economical, and all of
Okay. So Priscilla has also added that the social, right? So it's all the totality of health. Yeah, you can mute it now. Thank you very much, Kayode and then Priscilla. So it focuses on the social aspect of health, the physical aspect of health, the emotional aspect of health, right? So it's the totality of health, right? So you can't just focus on only one aspect. So if you treat only the pain without looking at the emotional aspect, whether the person is in good terms with the family, whether the family members are visiting, the spiritual aspect, how can the person still have a good relationship between him and the the spiritual being that the person is worshiping, whether it's God or any other thing, right? So we have to look at all these aspects whilst the person is being hospitalized. Okay, so palliative care refers to taking care of the whole person, including the body, the mind, the spirit, and the soul, right? So it involves, as I said, it involves the whole being, right? So you can't only focus on only one aspect of health, right? Let's look at other definitions. There are several definitions. If you want to define, we will not even finish the course today, right? Because there are several definitions from various books and then other authors, articles, journals, etc. Okay, so palliative care is also termed as the optimization of quality of life, right? So another emphasis is on quality of life. So even though the patient is dying, and then whatever we do, the patient will die because it's a condition that has no cure, right? But we have to make sure the patient live a quality life before dying, right? For both the patient with serious illness and then their families, right? So our focus is on the patient as well as the family of the person who is suffering from the terminal illness, right? Okay. Um, in contrast to hospice care, so there's palliative care is different from hospice care. Who can help us with hospice care? How is it different from palliative care? Hospice care and then palliative care. Yeah, who can help us with hospice? HOSPICE, hospice care. How is hospice care different from palliative care? I hope you are online and you can hear me. How is hospice care different from palliative care? Okay, I think there's no response, so I'll move on with that. Right. So hospice care is most of the time we admit uh, people for palliative care, right? Where with palliative care, we don't know exactly, we know that the person is suffering from a terminally ill condition, but we don't know exactly when the person is going to die anyway. But with palliative care, sometimes the doctor or the physician will tell the patient that you have less than some months to live, right? So the care given to patients who have like 6 months or less to live is what we term as hospice care, right? And then most of the time, some family members will request that they, with the hospice care, some family members will request that they take their relative to a hospice home, right? Where the person, because they know that we can't cure and then we are only managing the signs and symptoms. So sometimes they will take the patient to a hospice home, or sometimes they will even nurse the patient in the house, where they will hire a nurse or a doctor to be taking care of the patient in the house till the patient dies, right? And that is what we term as hospice care. So in contrast, palliative care approaches can coexist with curative treatment, right? So with palliative care, sometimes we add, even though we can't cure, it's we combine with some curative therapies, like for example, chemotherapy, treating the cancer with drugs, right? We can do it for people receiving palliative care, even though it can't cure it, but we can use the chemotherapy to halt the proliferation of the cancer cells, right? But with hospice care, we don't add any curative therapy as in palliative care, right? So in palliative care, we can add chemotherapy. Sometimes we can even do surgeries for people receiving palliative care where necessary, right? To prevent the spread of the cancer to other organs. But with hospice care, we don't add any curative therapy. Okay, so we are moving on to aims or goals of palliative care. I hope you are following. I hope you are all following. Okay, so aims or goals of palliative care. The first goal is to help to regard dying as a normal process, right? So we will talk about, okay. Okay, so you are following. Okay, that is fine. So I can see Nuela. Yeah, so you can mute it now and then. Okay, there's ambulance somewhere. Can we mute it now and then we continue? Can we continue now? There's an ambulance sound at the background. Can we mute it so that we continue? Sambian, can you mute your microphone?
Yeah, let me mute the microphone for
Can you mute it now so that when you want to ask a question, yes, good. Okay, so the aims or goals of palliative care include regarding dying as a normal process, right? So we will talk about the stages of death and dying, right? Where the patient will deny, the patient will be angry, the patient will begin, the patient become depressed, and then finally the patient accept, right? So it's our aim to help patients who are dying to accept it as something that is normal. Because if they don't accept it as something that is normal, most of the time it leads to anxiety, depression, and then it can even worsen the condition of the patient. So it is our duty as nurses to make sure that they regard the dying as a normal process. Okay, so who can help us? How can we help a patient to regard dying as a normal process? Because you know that dying is not something that is pleasant for the patient himself or herself, and then the family members as well. So how possible can we help patients to regard dying as a normal process? Yeah, so it's a question. Let's discuss. How can we help? If someone is on the floor, please let the person finish before you come in. Right? How can we help to regard dying as a normal process? Right? Because you know that dying is not something that is pleasant, especially if the person is not at the old age, right? Someone around his or her 30s, 40s is affected with these conditions like cancer, HIV, etc., that cannot be cured, right? And then the person is dying, and you want the person to regard it as a normal process, the person to accept the death. How can you help the person to achieve that? Yes, are we there? Okay.
I think you reassure the client.
Okay, yes, you reassure the client that
that the client is with a competent staff.
Okay.
And then you make sure that you monitor the necessary vitals, and then
Okay.
the relative to reassure them of competent care.
Okay.
And then you keep on monitoring the client, close monitoring and observation, and make sure that your documentation, everything is in order.
Okay. That is fine. Okay, so thank you, Sambian. I hope I got your name correct. Yes, so another person can also add to what she said. Okay, so is anyone adding? Yeah, Priscilla Entry. Priscilla Entry, your microphone is on, but you are not speaking. Okay. Yeah. So adding to what she said, it's more of okay. Can we mute the microphones now? Yeah. Yeah, so it's more of psychological care, right, for the patient. So she talked about reassuring the patient, right, of the competency of nurses. Sometimes even your demeanor, whilst you've not spoken, your facial expression alone will determine whether the patient will regard whatever you are coming to tell the patient, right, so that the patient will regard the dying as a normal process. So our facial expressions, how we talk to the patient, right? And then sometimes we shouldn't assume that the patient is anxious because of the anticipating death, right? Sometimes it could be that the patient is having some marital issues because of the condition, or probably family members are not coming around, or the patient does not have money to buy the pain medications, the chemotherapy drugs, and other drugs that have been prescribed. So we should allow the patient to express fears and then concerns, right, so that we can address those concerns. So we can also introduce patients to other patients who are going through similar conditions, right? And then where necessary, spiritual support, right? So if the person, the pastor of the person is Pastor TB Joshua, and then the person requests that until Pastor TB Joshua pray for him or her, he will not accept whatever care you are going to do. You have to, if possible, and then you can contact him or her. You have to let whoever the person wishes to pray for him or her to come around, or if the person, you can call the person on phone or whatever. Let the person do that, right? Your aim is to help the person to regard dying as a normal process. So whatever you can do to help the person to regard the dying as a normal process, you have to do it, right? So sometimes you have to counsel the patient. Sometimes you have to bring in the psychologist to speak with the patient and all that, right? It is our goal not to hasten death or to postpone death, right? So our main aim is to relieve suffering, but you are neither to postpone the death. You can't postpone the death, right? Because you don't know exactly when the patient is going to die, right? Yours is just to relieve the suffering and then help the patient to live a quality life before the patient dies. And then you are not to hasten the death, right? Which, so when we are doing ethics in palliative care, we are going to talk about these things. So it is not your responsibility to administer lethal dose of medications, right? Or to take off life supporting equipment like oxygen, etc., for the patient to die. No, that is not your responsibility. Your responsibility or your goal as a palliative care nurse is to help the patient to neither to postpone or to hasten the death, but only to relieve the suffering. Right? That is another goal. The next goal or aim is attainment of highest possible quality of life for patients and their families. Yes, so the families, you have to also focus on the family of the patient who is being affected with the terminally ill condition, right? So when necessary, you have to explain the condition to the family members. Most of the time, when family members come, we don't take our time to explain to them, because sometimes how they talk and then how they behave towards us, and these reactions is because of what their relative is going through. So sometimes we have to accept, and then we have to take our time, sit them down, and then explain the condition, right? And then we don't have to give false hope or false information when we are explaining the condition to the families of the patient, right? So if the patient is suffering from a terminally ill condition, right, the patient has less than some months to live, we should tell the relatives the truth, right? So we should not lie to them, right? You should tell them exactly what is happening. With if we are giving medications but still patient is not responding, we should let the relatives know the progress of the patient condition, right? Another aim is giving patient with life-threatening illness the best quality of life they can have by aggressive management of their symptoms. By aggressive management of their symptoms. What do we mean by aggressive management of their symptoms? Who can explain that for us? Giving patients with life-threatening illness the best quality of life, which I've explained, they can have by aggressive management of their symptoms. What do we mean by aggressive management of their symptoms?
Hello, sir.
Yes, sir. Kayode.
Yeah, I think by aggressive management of their symptom is like when you're having pain,
Okay.
the highest level of pain management that you can give, like opioid, should be given. If they're having nausea and vomiting, we should control it, because all those things can make them can make life very miserable for them. So we should eliminate every discomfort as much as possible.
Okay. Thank you very much. Yes. And this is what sometimes we are not good at as Africans, right? Because in the developed world, they don't care giving medications. Once you complain of pain, they will give till you verbalize no pain, right? But in Africa, sometimes we give 1, 2, and then we say that the patient will be addicted. So sometimes we let patient go through pains, right? So aggressive management of their symptoms is that if patient complain of headache, right, you can't feel the pain. It's the patient that is feeling the pain, right? Pain is subjective. So when patient complain of headache, you administer prescribed medication to relieve the pain. If patient complain of joint pains, administer prescribed medication to relieve the pain. So you manage their symptoms aggressively that patients will later verbalize a feeling of no symptoms or no pain, nausea and vomiting, as we said, or you will not see the dyspnea that the patient is experiencing again, right? So another aim is to relieve pain and control symptoms. So that is what we just said. And then to improve the quality of care for the patient and their families, right? So if you look at the goals, it's all talking about improving the quality of life, relieving suffering, and then the symptoms that the patient is experiencing, and then also focusing on the family, right? So we should not exempt the family from the care, right? So sometimes you have to even engage the family in the care when you are bathing the patient. Sometimes when you are treating pressure areas, you should be involving the family in the care. It's a form of helping them to relieve their anxieties and then to accept the patient, right? The condition that the patient is suffering from. And then we have to also offer support system, right? So which support system are we talking about? Sometimes the patient need spiritual support, right? Where we have to invite the hospital chaplain or the spiritual leader of the patient. Sometimes the patient is depressed, right? And then you are not expert in that. So it means that you have to invite a psychologist, right? Or you have to refer the patient to the psychologist. Sometimes you need a sexual therapist or a sex therapist, right? So with palliative care, we need all the therapies. Sometimes you need a nutritionist, right, to educate the patient on what to eat and then what not to eat, right? So when necessary, sometimes you need the social welfare people. You have to refer the patient because the patient cannot pay for the medications or the treatment, right? So it means that you that is what we are talking about, the support system. So you have to involve all these people where necessary. the psychologist, the chaplain, the counselor, right, the social welfare people, and others. So we have to involve them when necessary, right? Other goals, right? There are several of them. Using team approach to address the needs of the patient and their families, right? So don't assume that you can cater for all the signs and symptoms, all the needs of the patient. You can't do it alone. So there are times you have to consult the doctor, right? So if the patient complained of pain and then pain medication have been administered, whilst working on the patient, you realize that the patient is experiencing dyspnea or nausea and vomiting. You have to do your nursing management and report to the physician that the patient started vomiting at this time, right? And then when necessary, the doctor will add antiemetics, right? The doctor will add medications for the vomiting, right? So we have to work hand in hand with the doctor when necessary. So all the palliative care team members, so we will talk about the palliative care team members soon. We have to involve all of them. We have to work in group, right? But most of the time, sometimes there are grudges between the nurse and the doctor, and then all these will affect the patient. But our aim is to help the patient to die peacefully. So in order to do that, there should be team approach between us, the nurses, the pharmacist, the physician, right? So that we don't shift blames to one another, right? If you do that, the patient is going to suffer. Okay, and then we have to respond to people beliefs, right? So we have various beliefs. Those in Nigeria, can you tell us some of your beliefs, right? That's when you go to the hospital, probably you want the nurses and the doctors to accept those beliefs, whether being it cultural beliefs, religious beliefs, etc. Can you tell us some of them? Those in Nigeria.
Yes. Good afternoon.
Afternoon, Ajani.
Yes. We have some religious beliefs, like some Jehovah Witness members. Whenever they don't take blood transfusion. So
they don't take
even if they are
yeah, you can continue. Oh, okay, you are off. Any other person? Okay, so she was talking about Jehovah Witness. So as palliative care nurses, because they don't receive blood transfusion, what best can we do? So we are talking about responding to their beliefs, right? Responding to the beliefs and practices of the patient. Yes, so the belief of the patient is that they don't accept blood transfusion. So how best? And then our aim is not to help them go through their suffering, right? If the patient is having low HB can lead to anemia. So that is anemia, and then it can lead to dyspnea, fatigue, and other signs and symptoms. So how best can we respond to those beliefs, right? So that the suffering of the patient is relieved. Yeah, so who can help us? Yeah, so responding to patient beliefs. Yes, those in Ghana. Yeah, do we have any beliefs? And then how best can we respond to the beliefs of the patient? Yeah, you are on, so you can speak.
Yes, thank you, sir. Like for those that don't take blood transfusion,
Okay.
So we give that to them, and some of them take that one instead of being transfused. And
you give what? You said this instead of the transfusion.
No transfusion. They don't take it, but we give them injection.
Injections.
Yes, we give them erythropoietin injection.
Okay.
Then we place them on double dose Imatinib.
Okay.
And we place them on high proteinous diet.
Okay, okay, that is good. Yeah, so but sometimes it depends. If the HB is very low, like 3, if you delay, the patient will die. So sometimes you have to find out if the patient is terminally ill, and then there's a relative who can stand in and then sign a consent form that the drugs should the blood should be given. Then yes, you can go ahead and give, right? If the patient is terminally ill, sometimes they are even unconscious. If they are unconscious, then a relative can sign in, but stand in for the patient. But if they still insist that they don't want the transfusion, then you can't go ahead because of ethical issues. So you can go ahead with the injections and other ways to help to relieve the pain, as you said. Okay. Any other beliefs? Yeah. So those do we have Seventh-day Adventists? Do you have beliefs? When you come to the hospital and I want to prescribe streams for you, will you be okay? Are you there?
Yes, we are.
So how will you respond to that? Your patient is suffering from a condition where you have to prescribe crabs, shrimps, and those things, right? To give vitamins and all that. Yes. So how do you respond to the patient, the beliefs of that patient? The patient is a Seventh-day Adventist. The patient does not take those things.
You said there
Okay,
food
Faustina
sources.
Bones.
Yeah, yeah.
Uh-huh.
There are other rich food sources that you can get such nutrients from.
Okay.
So if shrimps and other things are not going to help, I think
Yeah.
the person can be educated, or the family, then they will be educated on the other rich food sources so that you get those required nutrients for the person.
Okay. Okay, so that is good. Yeah, so what it means is that you should not insist that the patient take it, even if it's against the beliefs of the patient, right? There are other ways you can help to achieve it without infringing on the beliefs or the rights of the patient, right? So we have to respond to the beliefs. Yeah, we have to respond to the beliefs of the patient. You have to be sensitive to the patient beliefs, right? Yeah, can you mute your microphone now? When you are answering a question, then you put it on. Yeah, so that is how we can respond to the beliefs of the patient. We have to be sensitive to the patient's beliefs, right? Sometimes we have to allow them to tell us their beliefs, right? So that we will know it and see how best we can work on that to help to meet their needs, right? We talked about goals of palliative care. Goals of palliative care is not different from the goals of hospice care. So I will not really go into it. It's similar to the goals of a hospice care, managing pain and other symptoms, creating a comfortable environment for the patient. Okay, so how do we create a comfortable environment for the patient? How do we make the environment comfortable for the patient? Yes, any person to help with that? Making the environment comfortable for the patient, a dying patient. That is one goal of a hospice care.
Hello.
Okay, Kayode.
Most time, people that are having debilitating condition, they are limited in their physical ability. Sometimes the environment may be modified, like providing them mobility, wheelchair, and then sometimes you may have to reduce noise from the environment, or lighting, adjust lighting. Then
I just
make environment, you know, appealing, not an environment that that will aggravate.
Yes.
Or
Yes. Okay, thank you very much. So already the patient is anxious, right? Some people may be depressed, right? So you have to make sure their environment is comfortable, as you said. So there shouldn't be too much noise, right? And then sometimes we make the environment uncomfortable for them, right? How? Sometimes Akosia will go and check vital signs. Ajua will come and give medications. Ama will come and treat pressure areas. Akuya will come and bath, right? So in doing that, the patient is already anxious, right? So we have to make the environment comfortable for them. We can group all these activities together, right? So there are several ways we can help make the environment comfortable for the patient. We can allow their family members, their friends to come around to chat with the patient, right? So that we make them comfortable, right? Sometimes when necessary, we can let them watch television, and then whatever they are interested in doing, if they want to read storybooks, right? So they are in the hospital, but we should let them feel at home, right? So that they will be comfortable in the hospital, because the change of environment alone can be a source of anxiety to some people, right? So it's similar to the goals is similar to the palliative care that we talked about. And we have to also give relief to the patient caregivers, right? So I said the focus is on the patient as well as the family. And then we offer counseling where necessary, right? So let's look at palliative care team, right? Palliative care team, right? So there are several members that forms the team of palliative care, right? So the patient is himself or herself is one of the members that forms the palliative care team, right? So the patient, the one suffering from the terminally ill condition, the family members of the patient, right? The doctor or the physician, the nurses or the nurse, right? And then the pharmacist, the nutritionist, the social workers, the hospital chaplain, all the therapists, right? So the physical therapist, the occupational therapist, the speech therapist, the sex therapist, respiratory therapist, that is if we have, right? The massage therapist when necessary, right? Etc. Right? So all the various therapies that we have. And then we have the volunteers, right? So the volunteer can be probably a friend, right? Or somebody who is not part of the palliative care team, but the person will say that because of the relationship between him and the one who is sick, he wants to volunteer to care for the person till the person dies. Probably the person has done something for him or her, and that is the best he can pay the person back, to care for the patient till the patient dies. So we add the person to the team, right? So that we will tell the person as to what to do and then what not to do. As we are moving on, if you have any question, you can ask before we continue. If you have any question up to this point, you are free to ask before we continue. Any question up to this point or any contribution up to this point, you are free to ask before we continue.
hello.
Yes, Kayode.
Yeah. Earlier on, before I lost my connection, you were talking about disclosure or informing the patient about their situation.
Your line is not clear.
Okay. Hello, can you hear me now?
Yes, I can hear you now.
Okay, we are talking about disclosure. I mean, telling patients their situation or their real circumstance, their actual diagnosis and their prognosis. One thing I've observed in my years of practice is that it's like a taboo that people, the medical personnel, they don't like telling patients their outcome or their prognosis possible outcome of their situation.
Yeah. Yeah.
And then, like the place I work in Nigeria, is teaching hospital. There is this establishment problem where about who should inform the patient about, you know, their
We are
situation.
finding it difficult to hear some of them. I don't know. Can you type? Because when it gets to the fact where we have to hear, we don't hear. Then you come on and off like that. I don't know if you can type for us. Yeah, Kayode, your line is not clear. You go on and off, on and off. Okay, so I've seen Eunice Ofori. You can do that by allowing patients to watch TV and read nice novels. Okay, okay, that is fine. That is fine. Yeah, so if the patient is willing to watch television and is available, yes, you can. Yeah. Uh, yeah, can you type for us what you were talking about? Yeah, so with the disclosure, it's very important. Sometimes it even prevents conflict between nurses or the health workers and the patient, right? Because if I don't tell the patient there's the information, there's that information, and then I give a different information, another person also give a different information, the patient become confused, and then sometimes they will attack us because we are not. I'm telling them that, oh, the patient is doing well, and then the relative asks another nurse, oh, the nurse also tells them that the condition is bad and all that. It means that there is conflicting information, right? So we should tell them exactly what the condition is. And sometimes, as you were saying, it depends on the hospital protocol, right? So sometimes it depends on the hospital protocol, and sometimes you should seek consent from the patient before disclosing some information, right? And then sometimes the patient will even tell you who to disclose the information and who not to disclose the information, right? So you should find out from the patient first. Okay, so I can read now on the issue of disclosure. Who is responsible in the team to do complete disclosure? It depends on the kind of information, right? So if it's breaking of news, probably the patient is diagnosed of HIV or cancer, then I think you need someone who is trained to do that, right? So sometimes, especially if patient pass away, then it's the duty of a doctor or the physician to break the news. Even though we are going to learn how to break a bad news to a patient, right? Sometimes you have to inform the doctor to do that. But other times it depends on the hospital protocol, right? If you are working in a district hospital or a health center, where sometimes you are working with a PA, right? And then you are allowed to break bad news. If someone dies, you can break the news, right? But if you are working in a hospital where you are not allowed to, based on the hospital protocol, then you don't have to do that. You have to let the doctor. So sometimes you assess the patient and then you realize that you can't feel the pulse, you can't see any chest movement and all that. You initiate your CPR and then still the patient does not respond. It's you are not responsible to certify the death. So you have to inform the doctor. And then when the death is certified, the doctor is the responsibility of the doctor to break the news, right? So as we move on, we will talk about the duties of each palliative team member, right? So that you know what a nurse can do, what a doctor can do, what a pharmacist should do, what a chaplain should do, and all that, right? I hope your question is answered. If not, you can type, I can read it here, right, as we move on. So if there is no question, we can move on. But if there is a question or a contribution before we move on, if there is a question or a contribution before we move on to the role of the team members.
I have a question.
Okay, Nancy.
Yes, please.
Yeah.
I said, please, with the beliefs, if you have a baby or a neonate as your patient, and
Okay,
then
so palliative care for children. Okay.
yes, please. And then there is a case of hemotransfusion, as we were saying earlier on. And then the relatives, maybe the father and the mother is not allowing, their beliefs are not allowing the transfusion. Can you go ahead and hide the baby and transfuse, or what should we do?
That is anyway, it's against the ethics. It's against the yes, Faustina Bones. Do you want to respond to the question or you want to ask a question?
Please, I'll respond to what Nancy was
asking. Okay, that is fine.
I think I saw a letter which is stating that with the children, they are under 18 years. Like
yes,
children under 18
so they are
years,
minor.
They are minor. So
Yeah.
since they are minor, the hospital can go ahead and transfuse. They are property of the state and not for the parents. So the hospital can go ahead and then transfuse.
Oh, okay. Then
And
that
the
is fine.
I want to also add is with the when patient condition, like the outcome is not good, sometimes you see that the doctors are running away from telling the patient.
Yes,
As
it
patients,
happens.
as nurses being patient advocates, we can talk to the doctors to ensure that they do that as patient advocates. Thank you.
Yes, thank you very much. Yeah, so if there is a letter of that sort, as you are saying, and then it gets to all hospitals and is accepted, yes, then we can do that. Other than that, for a minor, it's the responsibility of the one who brought the patient, being it the father, the mother, right, or the guardian, right, to give a consent for the patient to be given the blood transfusion, right? So what you can do is to convince them on the need for them to allow the child to be transfused, right? But if the hospital protocol says that the child can still be transfused even without the consent of the family members because he or she is a child, then you should go ahead and then you give the blood transfusion. Yeah. Yes, I think someone is on the line.
Hello.
Yes, Kayode.
Yeah, on the issue, actually, I'm doing my research on
Your line is weak.
And the way the principle of consent for us is different from that of children.
Seeking of consent.
It's breaking.
Your line is breaking. Can you do something for me? Do audio recording on the WhatsApp group. Kayode Olabisi, please do audio recording on the WhatsApp group. I will listen to it and then address it. Yeah, do audio recording in the WhatsApp group. I will listen to it and then address it. Yeah, so I think someone was saying that sometimes the doctors run away from their responsibilities. Sometimes when can you do audio recording in the WhatsApp group? I will listen to it and then address it. Yes, so sometimes when the family members are angry because probably they think the doctor or the nurses didn't do their duties well, that is why the patient died, right? So sometimes some of the doctors will vanish, and then they want the nurses to go and break the news. Yes, so it's our duty to advocate for them, to go and look for the doctor wherever the doctor is, and make sure the doctor break the news, right? And sometimes in breaking bad news, when we talk about how we can break a bad news, we just go ahead and tell them that the patient is dead, right? With that, you are going to increase their anxieties, right? So there is a process of doing that, right? So sometimes some of the doctors themselves, they don't even know how to break the news themselves. So when it comes to issues like that, you see them, they just certify the death, and then the next moment you will not see them. You'll be looking for them, and then they are nowhere to be found, right? And then you'll be forced to break the news because the family members will put pressure on you. They want to know the outcome. And then when things like that happen, most of the time you can't continue giving care again. And then they'll be wondering why their relative is suffering, and then you are there without giving care, and then you are also not telling them anything. So sometimes you'll be forced to break the news yourself, right? Okay, I can't see the audio on in the group. So Kayode, can you make an audio in the WhatsApp group so that I'll get what you were saying? Yeah, so let's continue. If there's no other contribution or question, let's continue. Okay, someone
Hello,
is online. Yes, yes.
we can hear you, sir.
You can't hear me.
Yes, and during the course of the lecture, you are on and off. The
Wow.
line is breaking.
Oh, sorry.
Thank you, sir.
Are you all having the same issue, or is only one person? Are you all having the same issue?
Yes.
Yeah, it's
Then, then I'm
Yes.
sorry.
off and it comes on.
Yes,
Uh,
the issue is
you,
general. General,
you,
sir.
okay, you should have informed me earlier so that I will know what to do. Um, okay, anyway, since it's on and off, then it means that I have to find another way of making it available for you. Is it still
Okay.
on and off? Is it still on and off?
It's better.
It's better now. Hello? Hello?
Hello, sir.
Yeah,
Hello,
is
sir.
it still on and
Hello,
off?
sir.
It's clearer now.
Hello, sir.
Yeah, can you hear me now?
Yes, sir, we can hear you.
Okay,
Yes,
okay.
we can hear you, but we can't see you.
You can see me.
But can't see you.
Oh, you have to see me. Oh. You have to
No,
be
we are
able to
not
see.
No,
seeing you.
we are
There's no
seeing
point
not
of
you.
now.
So what do I do so that you can see me?
We don't know.
I think it's from your side, not from my side.
Yes.
You have to I think make the video, put it on or something so that you can see me.
Also, when we started, you were seeing you, but along the line during the lecture, the video,
Oh, yeah, so that you can read my lips. Yeah, because I can see you, so I don't know why you are not seeing me. I saw someone, right?
we are
Okay,
not
there was,
seeing you, sir.
wow.
It's like it's loading, but it's
I'm sorry, someone was here who was helping me out, but the person is gone. Let me call the person to come around and see if so I'm coming. You can give me Can you see me now? Can you see me now?
No, sir, we can't see it. I think
Yeah, almost no,
sir.
Okay. Okay, so the person is on the way, so you will see me very soon.
Yes, sir. Thank you, sir.
Okay, so we are moving to the role of the team members, right? The members in the palliative care team, right? So let's start with doctors. Yeah, so what do you think will be the responsibility of a doctor in the palliative care team? What do you think will be the responsibility of a doctor in the palliative care team?
Hello, sir.
Yeah, I can hear you.
Yes. Yes, one of the roles of the doctors in palliative care is to give prescribed analgesic to the patient in order to relieve pain.
Okay, so they prescribe medications. What again?
Yes.
Any other?
To regulate doses when available, when times calls for it.
Okay. So sometimes they can stop the medication, sometimes they can continue the medication, they can change the medication, they can increase the dosage. Okay. Any other?
Hello, sir.
Then at last they have to certify death.
Okay, so if the patient dies, it's the duty of a doctor to certify the death. Okay. Yes. Any other? Is there anyone to add?
Not now from my end.
Yes, so someone can add the responsibility of a doctor in the palliative care team. Faustina.
Hello, sir.
Yeah,
hello,
you are
sir.
online, so you can speak.
Aside from the prescription.
Yes. What do you have to add?
They can still help to give an health education.
Good. Okay.
As regards the condition.
Okay.
And involve the family members.
Involve the family members, okay.
During the course of diagnosis to enlighten them about it. Thank you, sir.
Okay. So they are to diagnose, right? They are to diagnose and then also educate the. Okay. Can you see me now? Can you see me now?
No, I can see two. Yes, I can see.
You see, okay. Yes, so I can move on now. So is the responsibility of the doctor to diagnose the patient, right? And then it's also the responsibility of the doctor to do head to toe. Thank you very much. Head to toe assessment, right? So the doctor has to do head to toe. Okay, thank you. Head to toe assessment. And then, as you said, it's the responsibility of the doctor to educate the patient on the condition, right? And then where the patient has to sign a consent form for any treatment, it is not the responsibility of the nurse to obtain a consent form, right? So always we've been doing the wrong thing. We've been obtaining the consent form, but it's not our responsibility. It's the doctor's responsibility to obtain the consent form, and then as a nurse, you only serve as a witness. Are we okay? So as a nurse, you only serve as a witness to the consent form. Okay. So that is the responsibilities of a doctor in palliative care, right? There are other things that the doctor can do, right? So we have doctors who are nutritionists who can give the prescription for what the patient is supposed to eat, the dosages, and then all that, right? And then we have doctors who are sex therapists, doctors who are psychologists, and all that. So it's their responsibility to come in where necessary, right? So that they will provide the needed care that the patient needs. Okay, let's look at social workers in the palliative care team. What are the responsibilities of the social worker in the palliative care team? Faustina, you are online. Social worker. What is the responsibilities of the social worker? And when do we involve them?
Hi, sir.
Okay.
When it gets to the situation when they cannot afford to pay for their bills, that they are having financial constraints,
okay,
that is when we involve the social worker in their care, so as to support them.
Okay.
Thank you, sir.
So, thank you very much. Yes. So sometimes you have to involve the social worker. Sometimes you even have to. Sometimes they can't pay, and you have to identify some family members who are capable of assisting the patient to pay for it, right? And then sometimes you can even involve the church pastor or church members. They can also support the patient in paying for the treatment, right? Okay, the chaplain or the spiritual leader, what are the responsibilities of the chaplain or the spiritual leader in palliative care team? The responsibility of the chaplain or the spiritual leader in palliative care team. Nancy Boatin. Yeah, you are okay. You come on and off.
Hi, sir.
Or Niran. Is it correct?
Hi, sir.
Okay, you are online. I can hear you. You can go ahead.
When it gets to the extent of when they are in need of the spiritual support, as in terms of prayer.
Yes.
Because that's their belief at that critical period.
Okay.
So they will always involve them to come in.
Okay. So what about if they want to pour libation and then perform other rituals in the hospital? Will you allow them? They want to perform other rituals. They want to pour libation and all that. Will you allow them?
I can hear you, sir.
I said, what about if they want to perform some rituals, like pouring of libation in the hospital, and then other rituals? Will you allow them to do that?
Hello.
Yeah, Kayode Olabisi.
Yeah, I'm on another device now. I think my audio should be better now.
Okay, good.
Is my audio better now?
Yeah, it's better now.
Right. That's where our bias comes in.
Okay.
You see, obviously, we are biased towards those traditional people. I'm not traditionally, I don't have inclination, but justice. When we are talking about justice, we allow pastor to minister to people, and the spiritual people or imam or people as the case may be, or bishop as the case may be, there is no reason why we should not allow the priest of their faith, whether traditional or whatever, to minister to them. The only thing is that I think that we should seek for a middle ground to reach compromise, wherein anything that we feel may be detrimental to the...
Oh, okay, you are offline. You are offline. Yes, so it means that we should find out their beliefs, right? So if they are Muslims, and then the imam and other members want to come around, we should allow that, right? So if the person is a Muslim, it doesn't necessarily mean that you have to bring the hospital chaplain, right? Because the person does not believe in that, right? So you have to we have to be sensitive to the beliefs of the patient. There was this patient with stroke that we were nursing in the hospital, and then all of a sudden, after giving the medications, yes, we were giving medication, but we saw the relatives passing egg over the patient, right? So we were at the nursing station where we saw the relative passing egg about 3 times. So like that, right? And then we ignored it because that is their belief. Are we okay? And then what they were doing, the egg was not even showing well. So if you don't really look at them critically, you will not see it, right? And then it was not disturbing other patients on the ward, right? So if they are doing things that will not disturb anybody, then that is their belief, right? So as a palliative care nurse, we should accept all beliefs, right? As in a way of helping the patient to live a quality life, and then for the person to die peacefully, right? So you should not treat them badly because they don't believe in what you believe, right? That is what we are saying. So their spiritual leaders should be involved in the care. Okay, and then counselors, right? So sometimes there should be a counselor as part of the palliative care team. So what is the role of a counselor or a psychologist? So let's put them together. A counselor and a psychologist. What is their role in a palliative care team? There's a counselor and then a psychologist. I hope you can hear me. Okay,
Yes, I can hear you.
Olabisi, yes, you went offline. Welcome back.
Yeah, thank you, sir. A counselor and psychologist, they help patients to have insight into their feeling,
Okay.
into how they perceive themselves. If they understand themselves better, or their situation better, or the way their mind is running better, then they can be able to cope and then be more live a more happier life for the rest of their existence.
Sure. Very good. Yeah. So if you are not good at breaking the news, the person is diagnosed with HIV, right? And then you are not good at it. You are not expert in that. Don't do it, right? You are going to complicate the issue. So you can involve a counselor, because normally a patient has to be counseled before the test, and then after the test. In breaking the news, there should be a process. There should be a way of doing it, right? So if you are not good at that, you are not expert in that, it is not your responsibility as a nurse to do that. Otherwise, after breaking the news, the patient can even some patient can commit suicide due to how the news is broken to them, right? Yes, so we have to contact or refer the patient to other team members where we don't have expertise in those areas, right? Okay, a volunteer. I think I talk about a volunteer. A volunteer can be anything. It can be a friend of that patient, right? Sometimes it can be a family friend or somebody that the person has done something for in one way or the other, right? The person can decide that probably you have less than or a few months to live. So I want to spend those months to take care of you for what you did for me till you die, right? So that person, we term that person as a volunteer, and then we can add that person to the palliative care team, right? So that the person, so this person is not a health worker. So there are things that a person can do, and then there are things that a person cannot do. So the person can assist in bathing, feeding the patient, right, depending on the condition, right? In some conditions, it's expected that the nurses feed the patient, especially if the patient is on NG tube, right? Then it's the responsibility of the nurses to do that. But other than that, the volunteer can help in feeding. They can help in transporting the patient, but you should be there so that the patient does not fall. Otherwise, you'll be charged with negligence, right? So if you allow a volunteer to pull the wheelchair, right, and then the patient falls off the wheelchair, then that is negligence. Are we okay? So you should be there, right? So they can assist in transporting the patient from bed to the wheelchair, and then from the wheelchair to the bed, right? They can assist in, as I said, feeding, grooming of the patient, right? All these are things that we can do to help the patient to die a peaceful death, right? So sometimes they can make the hair of the patient, they can groom the patient, put powder everywhere, right? So that the patient will be looking nice. So sometimes you do that, and then you let them look in the mirror to see how nice they look and all that, right? So you can involve them in some of these activities, right? But you can't delegate them to give medications, no, right? So there are things that they can't do, like giving medications, even treatment of with bathing, they can bath. But when it comes to treatment of pressure areas, you know which their bony prominences, right? They do not know their bony prominences, and then you know how best to treat the pressure areas. So some of them you have to do it, right? But other than that, there's like changing positions and all that. They can assist in doing that. Okay, so that is the duty of a volunteer, right? And then families and friends, right? You can just allow them to visit and talk to the patient. Financially, they can support the patient to pay for the treatment and all that, right? Sometimes can involve family members in personal hygiene needs, right? Like caring for the mouth, bathing the patient, grooming, etc. Right? Yeah, so you can engage family members in some of these care. You will end here and then continue tomorrow from principles of palliative care. Principles of palliative care. So if you have any question or contribution, you can ask. We will end the lecture here. If you have any question or contribution. Okay. Yes, yes. Yeah, if there is any question or contribution. Okay. Yes, we are done with the lecture. If there is any question, any contribution. Okay, so I'm listening to the contribution on WhatsApp on the issue of consent for children.
or means, the hospital can seek legal redress if they feel that what the decision of the patient will not be the decision of the parent or the child will not be in the favor of the child. The hospital can take a legal means to make sure that what is best for the child
is done for the child. Okay. So thank you very much for your contribution on WhatsApp. Yes. So he was saying that sometimes if the decision the family is taking will be detrimental to the child, sometimes the hospital take legal means, right, to make sure the best is done for the child, right? So when we will do palliative care for children, when we get there, we will talk more on that, right? If there is any question or contribution to what we've done today, you are allowed. We are ending, I think, by 12, the lecture will end. So if there is any question or contribution. Hello. Okay. Since there is no question or contribution, I assume it is well understood, right? I assume it is well understood. So thank you very much. You meet tomorrow same time. I think it's Mondays, Tuesdays, Wednesdays, and Thursdays. So you meet tomorrow same time at 9, right? Yes. So unless you have a question, if you don't have a question, then that will be all for today. Thank you very much. And then read the slides that I sent you. Thank you very much. Okay, Priscilla, do you want to ask a question?
No, sir. It was a mistake.
Okay. Yeah, so we are done with the lecture. I'm calling. We on Team so that you let me post audio, so that they can have access to it. But who bet you actually me baby I may click it through that. I should hide the presentation, right? Okay, so I'm done with that. Share your screen. Restore presentation. Top right. Options. Make full screen. Settings. About. Help. Key. End meeting. Okay.